Senator Maanzo.
Thank you, Mr. Speaker, for giving me an opportunity to comment on this very important health bill, whereby we are talking of going digital and making sure that, Mr. Speaker, that hospitals improve in Kenya. Mr. Speaker, there has been a need to improve the processes dealing with hospitals in Kenya. From the time a patient reports or happens to be an emergency case in case of an accident, up to the time that patient is referred or transferred, or up to the time that patient leaves the hospital. And in the unfortunate case of death, then the whole process has to be complete. And the use of digitalization or making sure that everything goes keeps records faster. And the most important in proposal of this bill is the privacy of the patients. Because the moment things are digital, there's a likelihood of hacking and there's a likelihood of information leaking to the wrong persons, and that information may be used wrongly against patients. But the way things are currently is very manual, and you need, even the past records of the patient. The moment everything is in a digital form, you are likely to pick what is the history. And in the event that particular patient had collapsed or had just had an accident and is unable to talk for themselves, it is easier to pick that information from data. And once you pick that, it is easier to know how to treat or deal with that particular patient. The moment things are in a data form or in a digital form which can be accessed electronically, then it makes it easy also to effect payments. In the event the patient is insured, then it is safer for the hospital, and the hospital can proceed without first demanding monies to be paid or before the patient is attended to. But the moment the hospital from the database is aware that the sort of insurance that particular patient is operating under, it makes it much easier, Mr. Speaker, to process the patient and to be able to serve the patient, and even for the hospital to be paid. Now, this goes from the public hospitals to the referring hospitals and to the private hospitals, such that the data of this particular patient can be dealt with in those instances. And the whole idea is to make health very accommodating and to make it efficient. There's also the issue of health tourism. When people come to seek, medical assistance in our country, this has happened before. We have seen people travel from Burundi, from other countries to come to be assisted in our private or public hospitals here. The moment the patient is here, obviously they also will go on data, and you'll be able to know or to monitor how many patients have come to Kenya, as well as be patients and as well as be tourists. And then from the services that have been given, then they may refer to more people, and with that sort of data, then you are able to predict how to improve all the services to make them better. And also, Mr. Speaker, health is very important. And in a lot of cases, in the case of emergencies especially, you need to save the patient faster. And it really, really helps when you can get the history, the medical history of that patient to the doctor as urgently as possible before, the relatives come in or before the patient gains consciousness. And I think this is where life matters, and it's where it is critical. And it is at the same time, a lot of people have lost their lives. One of the biggest challenges in hospitals in Kenya has been in case of injuries, and there have been a lot of accidents because of motorbikes, and the patient needs to go through scan, so they have to be scanned, and then that information is processed. Experts of 3D scan are very few in the country. So the moment that is
Senator for Kwale, you may consult, but kindly keep it low so that we can hear the contribution by the Senator.
Thank you, Mr. Speaker. So the moment somebody has gone through scan. That's what determines whether the patient will be treated at that particular hospital or they will be referred to a different hospital. Mr. Speaker, this has to be guided by a law because that information is partly already electronic and it is transferable electronically. Even from the hospital, you are being referred to the hospital you are going to. So, Mr. Speaker, I support and I thank you for the opportunity.